How are you practicing breathing? What are you putting in your body? How is the baby not drowning?
I've wanted someone to ask this question. Here are some crazy baby facts that are going to make you appreciate life and babies and how cool they are. So number one, how are babies swimming in a pool of water? I don't know what's so funny. How are babies swimming in a pool of water for 9 months and their skin doesn't fall off? Babies are covered in a thick substance called vernix. It looks like cheese. It's waxy. It repels water. As they get closer to their due date, this stuff starts to fall off. So if your baby was like past due, your baby might have had like wrinkly skin or their skin started peeling because the vernix started to fall off. How are babies practicing breathing when they're hiccuping? Under your baby's lungs is a muscle called the diaphragm. Hiccups are a spasm of the diaphragm. So what happens is whenever you get a hiccup, and whenever we get hiccups, it sucks air into our lungs really quickly, which is what makes that sound when air passes through our vocal cords. But what happens in babies is it's practicing breathing by expanding its lungs. So it's filling with amniotic fluid, but it's expanding its lungs. So that's how it practices breathing. Next, how does your baby be fine on the inside, not breathing, but fix itself to do what it needs to do on the outside? While your baby is inside of you, there are 2 vessels. These vessels bypass the lungs because it's getting all of its oxygen from you. When the baby's face hits air, there is a nerve in the face called the trigeminal nerve. That tells the baby, I would like to breathe air now, and it begins to switch its circulation from the umbilical cord to air. It doesn't happen immediately, but it happens over the course of a few minutes. The umbilical cord will continue to pulse. That's a delayed cord clamping, so the baby's starting to breathe air and then also receiving oxygen still from mom. These vessels are called the Ductus, arteriosis, and the foramen ovale. Some people say it differently. But it's just this cute little vessel that just bypasses everything when it doesn't need to be used. When babies come through the birth canal, their chest gets squeezed, which can push out some of the fluid that's in their lungs. That's why sometimes babies who are born via when babies are born via C-section and they don't go through that squeeze, they have a little bit trouble transitioning from being an indoor cat to an outdoor cat because their lungs still have a lot of fluid in it, so sometimes we got to help them out. And I tell my patients who go through C-sections, that's very, very normal. But when the baby switches its circulation, those vessels that I talked about begin to close on their own. How crazy is that?